To assess a patient's respiration, first check for factors that can affect respiration, such as exercise, anxiety, acute pain, smoking, and medication.
Great. Okay, well, what I'm going to do is I'm going to raise your bed and then raise your head, and then I'm going to check your respiratory rate. Okay, sir? I'm going to have you lie on your back for me.
Help the patient into a comfortable position, preferably sitting or lying with the head of the bed elevated 45 to 60 degrees. Make sure his chest is visible, moving the bed linen or gown as needed.
Just relax for me.
Next, place his arm in a relaxed position across his lower chest or upper abdomen as you would to assess his pulse, or simply place your hand directly over his lower chest or upper abdomen. Observe a complete respiratory cycle of 1 inspiration and 1 expiration. Then, look at your watch. When the second hand reaches a number on the dial, or when the digital display reaches a round number, begin taking the respiratory rate, counting 1 with the full respiratory cycle. If the respiratory rhythm is regular, count it for 30 seconds and multiply the number of breaths by 2. The respiratory rate normally ranges from 12 to 20 breaths per minute. If the respiratory rhythm is irregular, or less than 12 or more than 20 breaths per minute, count the breaths for a full 60 seconds. As you count the rate, note the depth of the respiration by observing movement of the chest wall, or do this after counting the rate by palpating chest wall excursion or auscultating the posterior thorax. Describe the depth as shallow, normal, or deep. Also note the respiratory rhythm, which should be regular and uninterrupted, except for an occasional sigh. Observe for dyspnea and ask the patient to compare any shortness of breath to his usual breathing pattern. Adjust the patient's bed linen as necessary and discuss your findings with him.
Mr. Williams, have you had any breathing problems? No. Okay. Well, your respiratory rate, your breathing rate was 16, which is within the normal range.
First, make sure this intervention is appropriate. It may be in accordance with the healthcare provider's order, for example, or you can assess for adventitious breath sounds and signs of altered oxygen saturation, including cyanotic nails, lips, mucous membranes, or skin, restlessness, and difficulty breathing.
Deep breath. Deep breath. Good, thank you. You know, I'd also like to put a pulse oximeter on you to see how much oxygen is in your blood.
Okay.
Then, select a site to place the sensor, such as the patient's earlobe, the forehead, the bridge of the nose, or a finger.
Nice and warm. That's good. Okay, I also want to look at your feet.
Okay.
I'm going to remove your sock.
All right.
Okay, I think your hand will be the best place for the pulse oximeter.
Okay.
Avoid a finger on the same side as an electronic blood pressure cuff, and avoid any site that has edema, altered skin integrity, or hypothermia. For a finger, remove any nail polish or artificial nail with acetone or polish remover.
Check your capillary
In the
refill.
selected site, assess the capillary refill. If it's more than 3 seconds, select an alternative site. If capillary refill is less than 3 seconds, ensure that the site is free of moisture. When a patient has special needs, plan to use an ear for a patient with tremors, an ear or bridge of the nose for one with peripheral vascular disease, a disposable tape-on sensor for an active patient or obese patient, or a clip-on sensor instead of a disposable adhesive one for a patient with a latex allergy. Position the patient comfortably. If you're measuring pulse oximetry on her finger, instruct the patient to breathe normally. Then attach the sensor to the selected site, instructing the patient that the clip-on probe will feel like a clothespin on the finger, but won't hurt. Turn on the oximeter. After you get a pulse waveform and intensity display and an audible beep, assess the patient's radial pulse and compare it with the oximeter pulse rate.
So this is a pulse oximeter, and what it does is it uses light to measure how much oxygen is attached to hemoglobin in your blood. And that's going to be this top number here.
Leave the sensor in place until the oximeter reading is constant and the pulse display reaches full strength during each cardiac
And the
cycle.
bottom number is your heart rate. 60 to 100 is a normal heart rate. Now I'm just going to palpate your radial pulse and compare the heart rate I have, palpating your pulse, with the number the machine is giving me.
Then read the peripheral oxygen saturation, or SpO2, on the digital display. For continuous monitoring, adjust the alarm limits for the SpO2 and pulse rate based on the patient's condition and/or healthcare provider's orders, and verify that the alarms are preset and on.